Good afternoon and welcome to the Flint Community Webinar. It is Friday. You've made it through the week, and we're so glad that you have decided to share your Friday afternoon with us here at the Flint Community Webinar, your community resource. We have a wonderful lineup. You knew that was coming. We have a wonderful lineup for you today. I should introduce myself. Usually I'm on the back end of things, but Dr. EJ is taking today off. She's enjoying some time with her family, and we're grateful that she is able to do that. I'm Heather Lynn Uphold, faculty here in Flint at Michigan State University. This lineup today. You may have been hearing about fluoride and, oral health, dental health, lots of things in the news. We wanted to make sure that you were as equipped as possible to make good decisions for yourself and your family. So we've got some folks joining us today to help with that conversation. So we're going to be talking about some everyday dental tips, fluoride, HPV. We've got Jim Milanowski from the Genesee Health Plan, who's going to talk to us about access and position the conversation for us. Then we're going to go right into talking about those dental tips, some fluoride information that you need to be mindful of with Dr. Stephanie Fatui from the Mott Children's Health Center. We're glad to have her. First time on the webinar, so we're glad that she's here, as well as Dr. Caitlin. So we have Caitlin Learoff, and she's going to talk to us about HPV. She's our infectious disease preventionist. So if you have questions that perhaps we aren't covering today, put them in the chat. We'll do our very best to answer them for you. So I'm going to invite Jim to join the conversation, and we're going to get started. So take us away, Jim.
All right. Well, thank you. Thank you for this opportunity. This is a topic that I'm very excited about. And I get excited about a lot of things, but oral health, a lot of times we really neglect that. Wanted to kind of set the table, as you had mentioned, Heatherland. Kind of if you're eating lunch right now, I'm kind of the appetizer, and then the real good stuff is coming up with Dr. Fatui and with Dr. Liroff. But let's go on to the next slide. Genesee Health Plan, and I'm the president and CEO there, has really, there's some important things that we have been involved with, and I just want to highlight those to the group as kind of reminders. So the Genesee Health Plan will provide an oral health care coverage for those who are uninsured. And that's, we do a whole medical coverage, but dental is part of that. Because dental and medical are so connected to each other. So it's important for those who are uninsured in our community to get dental coverage. And so they can go to really almost any dentist with that dental coverage. It's with Delta Dental, so it's really part of their network. And so people can free, and it's been a lifesaver for a lot of our members to get that dental coverage. Veterans. It became apparent to me, and it was really shameful that if you're a veteran and you're discharged from the military without a oral health condition then you're not eligible to receive dental coverage upon discharge. And so we have a lot of veterans in our community that are walking around with poor teeth because they've not been able to get those treated. So we about 6 or 7 years ago instituted where veterans could also get oral health coverage through the Genesee Health Plan. So we're excited about that. And seniors. A lot of people think, oh, Medicare covers dental. No, unless they buy a supplemental coverage that has dental in it, then seniors don't have it. So here you're taking care of your mouth all of these years, and then once you get on Medicare, you can't. And so unless you're going to pay out of pocket. So those are the real pockets that we cover. And if people have any questions about that down the road, I gave my contact information out at the end, but I just want to remind people of those coverages. So if you need help in those areas, we can certainly assist at the Genesee Health Plan. And next slide. So another important facet that we do at the Genesee Health Plan is make sure people are enrolled into healthcare coverage. And most of these healthcare coverages have a oral health or dental component. So all our staff are certified to help enroll people into what they qualify for, including Medicaid. And what's unique about Medicaid is that when you sign up for Medicaid here in the state of Michigan, you're assigned to a health plan like a Molina, HAP, McLaren, and then they have their own dental network, dental agreements. And so it's very important when you're signing up for your Medicaid to kind of know that and to ask questions about what dental network do they do? What network do they use? And so that's one area. Medicare is another one that we enroll people. And I just mentioned we can help find supplemental plans for people so that they can have some type of dental coverage. And then MiCHWA, Healthy Kids Dental, and we have Dr. Fatui talking from Mott Children's Center. It is so crucial. If you don't listen to anything else that I say, is that no child in Genesee County should be uninsured. We want to make sure that they have health care coverage, they have dental coverage, and that they're going to places like Mott Children's Center to get their dental care and their medical care. So there are so many resources out there for families. Don't let your kids not be covered. Next slide. So we also do a lot of educating on the importance of oral health, and I'm just going to touch on a few. But and we're going to talk more about our kids in a second. But for instance, things just as simple as kids should not be put to bed with a bottle of milk or juice, and a lot of times, and we're still doing that as a way of having, but that's just so terrible on their teeth and. As their gums and their mouth are forming at that point. Kids should go to the dentist regularly. Sometimes, as parents, oh, that can wait till they're older, they're brushing their teeth. No, we need to start getting them, even when they're infants, into the dentist, starting to get a dental home together so that they go regularly. And as adults, that is so important. We talk a lot about establishing a medical home, having a doctor that you trust that you can go to get your health care from, to ask questions. Same thing with a dentist. You should be going on a regular basis to see your dentist as well. And what the sad part is, we talked about the insurances, the Medicaid, and all of that. What they're finding is that people have this great healthcare coverage, dental coverage, but they don't use it. That going to the dentist sometimes isn't a priority, and that almost is a discussion of another time. But what are some of those things keeping people? What are those barriers from keeping from them from accessing the dental? And so really, whether it's transportation, but there are a lot of fears out there. You talk to people about, oh, well, I had a bad experience, or my grandmother had a bad experience. We're not a family that go to the dentist, and I can tell you, and I see Dr. Polk is on here. There's a lot of dentists that care has really improved over the years, and what was bad or painful or uncomfortable years ago is so much better. And so I would certainly encourage you, and we can certainly help, and those on the call and on this webinar can help trying to overcome some of those barriers. And then the last area that I wanted to touch on was fluoridation. That's fluoride that's been added to our water. That's been happening in our state. Fluoride in the water has been over 75 years. And I had asked Dr. Raymond Gist to be on this webinar, and he couldn't make it. But Dr. Gist, who's retired from his practice now, remembers when there wasn't fluoride in the water and how rotten people's teeth were in general because fluoride wasn't there, and how wonderful it has become that we have this resource. And so he wasn't able to be here, but he wanted me to reinforce that. Next slide. So, current recommended levels of fluoride to benefit health is zero point 0.7 milligrams per liter. And I'm not a scientist like a number of people on this call, but to show how infinitesimal that is, it's like 1 cent in $14,000, 1 minute in 1,000 days, or 1 inch in 23 miles. The amount of fluoride that is added to reap the benefit is so small, that is added to our water supply, and it's so cost effective. So, if for every dollar that you cost for the fluoride to be added, you're getting $38 per dental treatment in savings. So again, so important to have. Next slide. And the last thing is that the Genesee Health Plan also hosts a local oral health coalition. We're part of the Michigan Oral Health Coalition, which is a statewide advocacy and educational group. We host a local coalition with dentists and dental hygienists and universities and colleges and dental plans and health providers, including like Mott and Children's Center and safety net organizations. And we talk about a lot of these issues. So if you'd like to be a part of that, please contact me. And if you'd like to join, we usually have like quarterly meetings, and they're really great to know what's going on locally and how we can make a difference and educate the community. Especially, you've been hearing a lot about possible reductions in Medicaid. I would not be surprised if dental would be on the chopping block. That has happened in the past, and for some of us who are old and remember those days where there wasn't good dental coverage like there is now for children and adults, but there's going to be changes. I think that's inevitable. And this coalition will be a great work group to start working on some of those challenges and so forth. So I am going to stop there. My next slide just has my contact information. Please let me know if you have any questions, or email me if you want to be a part of that coalition. But again, I am so eager to hear the rest of the speakers talk about this and about HPV. We've used Dr. Leroff in the past to really educate our community on HPV, and that also involves oral health sometimes as well. So I'm going to turn it back over to you, Heatherlyn.
All right. Thanks, Jim. Folks, if you have questions about access, all of the things that Jim has talked about, we're hearing a lot of things in the news. GHP, Jim, his staff are all wonderful and great resources. We're so grateful to have you all in the community. So reach out to them. Very often, even on the webinar, we have some of Jim's folks that join. So we will do our very best here to get your questions answered, or reach out again to GHP and they'll get you taken care of. Thanks, Jim. That's super helpful. And we want to continue this conversation not only today about oral health, but in the future. We've got some plans I'm seeing in the Q&A and the chat. Questions are already coming up. So this is a good, timely conversation. And we're glad, Jim, that you could start us off. Next, we're going to turn our attention to Dr. Fatui. We're so glad that you can join us. Bring your expertise. You are here working in the community, and we're glad to have your perspective. Help us learn more about what we should be thinking about for our oral health. Even more questions coming up in the chat. Gosh. All right, so let's jump into what you have to share, and then we'll get into some Q&A.
Thanks for the introduction. My name is Stephanie Fatui, and I'm a pediatric dentist at Mott Children's Health Center. So we serve patients in Genesee County, children and adolescents at the health center in dental, medical, mental health, and wellness services. So I'm going to touch on oral health overview and recommendations for the pediatric population. Next slide. So I'll also talk about some common oral health issues that we see, and then focus on the role of fluoride in caries prevention, especially talking about the current opposition to fluoride that we're hearing in the community, and then review the importance of collaboration between providers. Next slide. So just starting off with the process of dental caries, caries is the most chronic infectious disease in children, and it is largely preventable. And this starts off as an interaction between sugars, bacteria, and tooth enamel. When bacteria metabolize sugars and produce acid on the teeth, they start to demineralize over time. And the earlier a child is exposed to bacteria, the greater the risk of developing caries is. And this infection results from exposure to bacteria through contact with saliva, and this can be direct contact from the parent or the primary caregiver. So caries is extremely prevalent in the pediatric population. It is nearly 5 times more common than asthma, 7 times more common than hay fever, and 20 times more common than diabetes. And children are 3 times more likely to miss school as a result of their dental pain than their counterparts. And this emergency dental care accounts for a loss of up to 34 million school hours annually. And tooth decay affects about 40% of children ages 2 through 11 in the US. And this graphic shows the total and untreated caries throughout childhood. So it's pretty high, starting off with the young kiddos as early as 2 to 5 years old, with 20% having caries. So oral health impacts general health, nutritional intake, development, speech, quality of life for kids. And this is why the early intervention and prevention are so important. And the American Academy of Pediatric Dentistry recommends establishing a dental home by at the latest 12 months of age or within 6 months after the first tooth erupts in a baby's mouth. And this is because 1 in 5 children under age 5 have experienced dental decay. This is just an overview of what our caries risk assessment looks like when we are determining the likelihood that a child will have an increased incidence of caries during a certain time period of their childhood, and the likelihood that there will be a change in the size or activity of the caries that the child has. So with this chart, we're able to detect caries in the earlier stages, and this helps us to prevent the occurrence. So as you can see in this chart, there are different risk factors and protective factors. And the main protective factors for preventing caries include fluoride. So fluoridated drinking water, fluoridated toothpaste, and then some of the risk factors start as early as, like I mentioned, the direct contact with a parent's saliva. So the incidence of caries in the parents. And then this also goes into diet, bottle, sugar sweetened beverages, things like that. So anticipatory guidance is what we use to educate and counsel parents on their children's health to prepare them for the different milestones they'll go through, physical, emotional, and psychological when coming to the dentist. And we focus on things like the timing of teeth erupting in the mouth, growth, speech and language development, nutrition, different habits, and injury prevention and trauma. So I'll start with these different topics. We'll start with oral health milestones. This is just important education for parents to be aware of why it's important to establish a dental home so early and know when different teeth are coming into the mouth and what to expect. So around birth to age 3, we start to see the first tooth erupting starting as early as 6 months of age. And by about 2.5 years old, all of the primary teeth would be erupted in the mouth. And then around ages 6, the first permanent molars erupt, and we'll have a lot of parents complain about what they think is a toothache, and it's a tooth erupting in the mouth around that time when the first molars come in, and when some teeth start to get loose and the baby teeth start to fall out around this age too. So this is just important to have parents be aware of what to expect in their child's mouth. Teething is another issue that parents commonly face, and this is the eruption of teeth, which could lead to discomfort, irritability, sometimes accompanied with a low-grade fever or excessive salivation. And the treatment we recommend would be oral analgesics or teething rings. A lot of parents will ask about topical anesthetics like Oragel at home, and this should be avoided. because benzocaine is contraindicated in children under 2 years old because it can decrease the amount of oxygen delivered to the body's cells in these young kids. So it's extremely important that we educate parents on, avoiding these products and focusing more on oral pain medication or teething rings. Dental trauma is another common problem that we see in children, with about a third of preschool children experiencing dental traumas and about 25% of school-aged children. And the most common age we see trauma is between 2 through 6 years old. And facial trauma affects children based on, it causes different functional, aesthetic, or psychological effects on children. And oftentimes a dental trauma could be the reason why a child has their first dental visit. They've been neglecting coming to the dentist, and then the child falls or hits their teeth, and that's the first time we'll see a child to establish care. It's important that we can provide this anticipatory guidance to parents so that they know what to do when there is a trauma. And we commonly see frequent occurrences in children of traumas. This is why education is so important. And so we could improve outcomes if the public were aware of first aid measures and the need to seek immediate treatment when traumas occur, and if injured children have access to emergency care at all times. So, a helpful thing would be if primary care providers could inform parents about different ways to access this emergency dental care, or provide, dental contact information for after-hours emergency care, so that parents are aware and, schools are aware when a trauma does happen. We focus on prevention for infants and toddlers with things like different toys they're playing with, the use of pacifiers, which I'll go into, electric cord injuries, unintentional falls when kids start to get moving. And then as they start to develop their motor coordination more, counseling should include safety measures, preventive measures on, with sports, high-speed activities, with making mouth guards, using helmets, face shields, things like that to prevent the front teeth. I'll briefly just touch on what we see with avulsions. So when the tooth is completely dislodged from the socket, when it's a baby tooth, you don't want to ever put a baby tooth back in the mouth when it falls out. So sometimes parents will call and we can tell based on the age if the child is 3 and they say the tooth comes out. But when a child is 6, 7, or 8 and we don't know, if the tooth is a baby tooth or a permanent tooth, it's important to know the difference. And so we never want to put a baby tooth back in the mouth. But typically when a baby tooth does have a trauma, we usually just observe it. So there's typically not much treatment other than to observe it, but we'd still want to see these children in the office to actually make sure, nothing else happened. And careful follow-up is always required to monitor what could possibly happen to the development of the other teeth and the eruption of permanent teeth in the future too. But with permanent teeth, if a permanent tooth does fall out, which could happen, and this could happen, at schools, on the playgrounds, it's important to educate the public so that they're aware what to do in these emergencies too. Because if a front tooth falls out, we want to put it back in the mouth as soon as possible. And if this can't be done at the place of injury, we want to store the tooth in some sort of medium. So the best and most common one that people might have on hand would be milk. And if milk can't be used, it could be put in saliva. But we don't want to keep the tooth dry. So it's important that the public is aware of this so that they can, educate those around them so that if this emergency does happen, we have the best possible outcome for this tooth, the prognosis of this tooth. Sucking habits. So there are 2 different types of sucking. There's nutritive sucking, which would be breastfeeding and bottle feeding. And then we also have non-nutritive sucking habits, which are the comforting habits we see in the use of pacifiers, thumb sucking, digit sucking, and these all could apply forces to teeth and different facial structures. So the American Academy of Pediatric Dentistry recommends stopping pacifier use by age 3 at the latest. And although early use of pacifiers and digit sucking is considered normal, beyond 18 years, pacifier use could influence developing oral facial structures, and children who do use pacifiers or digit habits beyond age 3 have a higher incidence of different malocclusions. So this could include flaring of the front teeth, open bites, back teeth having cross bites, things like that. And management of these habits could include, parent and patient counseling, helping them find other ways to not, to mitigate the habit, behavior modification techniques, or appliance therapy if needed. With breastfeeding is another topic that's important to cover. Prior to 12 months of age, breastfeeding is recommended to ensure the best possible outcome for health and development of infants. But beyond the first year of life, breastfeeding could be associated with early childhood caries, especially if frequent or nocturnal. So this is another topic where parents might breastfeed children for, past age 1, and it's important to know that nocturnal breastfeeding or frequent feedings could be associated with early childhood caries. With sugars, so the two most important things to focus on with critical prevention of dental caries is the age at which sugar is introduced to a child and the frequency of when the sugar is consumed. So the American Heart Association recommends sugar in food and drinks are avoided in children completely under age 2. And Academy of Pediatrics recommends 100% fruit juice should never be introduced to a child before 12 months of age and be limited to 4 ounces a day for children between ages 1 through 3. And the goal would be to avoid added sugars in the diet of children younger than 2 and minimize exposure to sweet tasting drinks and foods during early life to reduce the taste preferences that the child would have for sweet. This is a chart from the American Academy of Pediatric Dentistry, and it covers healthy beverage consumption. So it talks about the juice recommendations, and in terms of water, it talks about fluoridated water. So plain fluoridated water should be introduced into a child's diet beginning at 6 months of age, not only for hydration, but also to have the caries protective benefits of fluoride. And fluoridated water would be the preferred beverage for children 1 through 5 years old when not part of a meal or snack. And we would only recommend that 4 ounces of juice at meal times, not sipping throughout the day. That frequency of the juice sipping throughout the day is what also increases caries. So now we'll touch on the role of fluoride. So fluoride does act in 3 ways to prevent caries. And this is through strengthening the enamel, remineralizing enamel, and then reducing acid production by those bacteria that cause caries. And when combined with other dietary, oral hygiene, and preventive measures, the use of fluorides can reduce the incidence of caries. And there have been many clinical trials that have confirmed the anti-caries effect of professional topical fluoride treatments at the dentist. So professionally applied fluoride treatments are recommended for all individuals at risk for dental caries. Fluoride in drinking water, and then along with brushing with fluoridated toothpaste twice daily, are the 2 most effective methods to reduce dental caries prevalence in children. And fluoride does work in 2 ways. So it works both topically and systemically. So topically, when fluoride mixes with your saliva, the saliva neutralizes the acids that are produced by your bacteria on your teeth. And the fluoride joins the enamel on that tooth surface and protects the teeth from further decay. And then systemically, when you swallow fluoride, well, in young children, when the teeth are still forming, the fluoride can combine with the calcium and the phosphate of the developing teeth and makes these teeth more resistant to decay, especially for the first few years after those teeth erupt in the mouth. So we have research that has confirmed the systemic use of fluoride does increase the concentration of fluoride on the surface enamel of teeth, which is extremely important. So community water fluoridation, this is it is recognized as one of the 10 greatest public health achievements of the 20th century. And essentially, fluoride exists naturally in nearly all water supplies. And the term water fluoridation is just when the public water systems adjust the level of fluoride in the water to make it the optimal level for preventing tooth decay, which, like Jim mentioned, is 0.7 parts per million. And they just adjust the water supply to what it already has of fluoride to be at that caries preventive level. And we do recommend fluoride. So a lot of parents will commonly ask, like, can we not use fluoride on, our 1-year-old? And so fluoride is recommended. Like we mentioned before, the first dental visit should be established by age 1. And in infants, parents can wipe their gums with a soft cloth daily to help them start to, be familiar with that feeling of how, toothbrushing will be. And then by the time the first tooth erupts in the mouth, we can use a grain of rice-sized amount of toothpaste, a fluoridated toothpaste for children younger than 3. And then from 3 through 6, we recommend a pea-sized amount of toothpaste. So parents should also still be monitoring their kids brushing until at least age 6, or going back in and brushing after they brush, and encourage flossing once the teeth start to touch, so once the contacts between the teeth close. But the grain of rice size amount and the pea size amount are important when parents ask, can I even use fluoride toothpaste? And if we monitor the use of these fluoride products, so by monitoring the use of how much toothpaste is used, this prevents the ingestion of excessive amounts of fluoride, much more than water would have the effect on children systemically. So right now there's a lot of growing opposition towards fluoride and topical fluoride resistance. And this is starting to mirror trends with vaccination refusal in medicine. And a lot of parents and caregivers are concerned about their child receiving fluoride or may refuse it completely, even though fluoride is safe and effective. And there's so much information. I have some links at the end with different resources that are helpful to share with parents that answer all the frequent questions about fluoride they might have. And it's extremely educational, and it helps parents to understand why fluoride is so important, because there is a lot of misinformation that exists as well. But it is established to be safe and effective. So prevention for caries should begin in infancy, and it's important that we work together with physicians and nurses who might also be the people who have the first opportunity to educate a family, more than a dentist would, because they, have more contact with the family in the child's first year of life than a dentist might. And primary care physicians can also apply fluoride at well-child visits, which is this, a great way to educate the families as well on fluoride before we might get to see them at the dentist. And we can also focus on educating parents on oral health at well-child visits, on the topics like limiting sugar intake in foods and drinks, avoiding nighttime bottle feeding with milk or sugar-sweetened beverages, avoiding bottle usage or breastfeeding past 12 months of age, especially if it's frequent or nocturnal, like we mentioned. The twice daily brushing with the smear rice size amount or pea size amount of toothpaste, and then educating on fluoride to address any sort of parental reluctance or fluoride misinformation. So the main important takeaways are that we should establish a first dental visit by age 1, and oral health starts early, so prevention is key. That fluoride is safe and effective for children in reducing caries, and primary care physicians play a vital role in helping with prevention and early detection of caries. And this collaboration is so important because, a physician might have the opportunity to interact with the family before the dentist. So parental education is ongoing, and we continue this anticipatory guidance throughout childhood as the child hits different milestones. But it's important to work together as a community, as different providers, to help educate families to get the best care for their child. And then on the next slide, I have some different resources. This second website here has a lot of information on fluoride that it's all backed by research and is very beneficial for parents and families. It sort of answers questions scientifically, and then in like a less scientific way to explain why fluoride is so important. So these are great resources to share with parents. And the third one also has lots of good images and little one-page sheets on trauma as well, which might be helpful for parents, teachers, etc. So with that, I'll answer any questions. Thank you.
Ooh, and we've got some questions coming for you. So we have some questions on the call that I'm going to invite to join us. I think Dr. Taylor is here. We might even have another dentist. So if you're here, join on in. Dr. G is here too. So we want to get your perspectives, your call, or your questions answered. Some of the things that stood out, if you could just talk to us about, you mentioned that when a child loses their tooth, or really anyone, you want to put, number one, what was it? Pick it up by the crown. So is that the part that was in the mouth?
Yeah, the white part that we can see. So
Okay.
when it comes out, it's the part that we normally, like, you can touch on your mouth. Yeah.
And why is it important to pick it up by that versus like the, sorry, I don't know why I'm
That's
feeling.
okay. The root is the part we don't want to touch. We want to keep those cells. Those are the ones that they're going back in the mouth, and they're going to be the ones that we want to reattach. And they have cells, they're called PDL cells. We don't want to touch them because when they get touched, those are the part that we want to keep alive, that when they go back in the mouth, it's important that we don't touch them. So that's why if the tooth is dirty, like in the playground, if it falls in mulch or something, we want to rinse it before we put it back in the mouth. But grab it by the crown still and rinse it, and then you can put it back in the mouth. We just don't want like pieces of debris to go back in.
Yeah, that wouldn't be very, yeah. And then when that happens, you would direct someone to still go to their dentist and follow up, or I see Dr.
Oh,
Taylor's nodding her head as well.
good.
Yes. Dr. Fatui, is that what you would recommend?
Yes. So still always go to the dentist right after, because even if they replant it and it's not in the right positioning, we can adjust it. But that just helps to keep those cells vital for as long as possible. But the child should promptly go to the ED or the dentist as soon as possible. And if they come to Hurley Hospital, that's where we work out of. And so we have a pediatric dentist resident will always be on call to go see a child there. But if the tooth isn't replanted, that's the critical window of time that we want to get the tooth back in is within an hour. So it's super important to get there ASAP.
Or put it in milk.
Put it in milk and then still come in that 60-minute window. We want to try to see the child as soon as we can.
Okay. All right. Dr. Taylor, what do you see? What are your thoughts?
I feel like I echo so much of what she was just talking about. So many times now, just thinking about that, there's so many times that folks will come in with their kid and they'll have their tooth in a bag, and I'm like, no, no, I like put it back in, put it back in. And so there's plenty of times that I shoved the tooth back in and be like, go to the ED right now, so that way we can get this redone. So I think that's a super important thing and something that we try as pediatricians to discuss about too, because we wanted to because again, we wanted them to know before that happens, and teeth fall out all the time. So it's very common, just like she was talking about. I think that's a huge thing. And then another part that I want to emphasize too in there, I feel like this is our pediatrician part, is that the juice in the sugared beverages is a huge thing. I think a lot of folks are really love to give juice or Gatorade or different like fruit smoothies, different kind of things that like are sneaky juice in there. And especially before 12 months, don't eat anything besides breast milk and formula, and then solid food introduction. And it's such a big important thing about like overall health, but tooth health as well. And so that's a huge thing. I think a lot of folks have this concept that juice is healthy and different things like that. And it really takes out, I'd rather them eat the apple than drink the apple juice. And then getting children to enjoy water is really important. And so I'll even, be a proponent if they're like, no, they hate water and different things like that. Doing half and half, a quarter and half, so it still gets that taste, but you can kind of wean them onto water off of juice. So I think that's a big thing too.
Here's a question that has come up a couple times, and maybe you both can speak to this. What if the kids don't want to go to the dentist? I know sometimes it's a challenge for even me as an adult to go to the dentist. Kids, it can be scary, especially if you're not used to somebody, noodling around in your mouth. What are tips? What can parents do?
I think that's a big thing. So that's why we recommend, as pediatricians, we see them usually typically before they go to the dentist. So we love when kids, we start recommending establishing with a dentist starting at first tooth eruption. So that can be as early as 6 months. And so we always really, really want a child to be established with a dentist by 2 years old. And I think that helps because at that point, then it kind of normalizes it. Just like they're okay coming to the doctor, even though sometimes we give them shots. They're still okay with it, and so it makes it a much more like acceptable experience. I feel like the folks at Mott do a great job too. So especially with a pediatric dentist, I think you guys they can be so helpful and make it such a fun experience that it's not like holding you down. I know I don't love the dentist myself. I've gotten plenty of root canals because I didn't have fluoride in my water when I was growing up. So that's a big thing. I think, a big thing is like the sooner that you start, the more normalized it is. And so I think that that really helps rather than going at 4, 5, 6. So that's a big thing. And then sometimes, we always talk about even with this stuff is um, having a reward or a treat or associating it with something positive is always going to be helpful. It doesn't necessarily have to be a sweet treat, but going to watch we're gonna go to the dentist and then we're gonna go to the park, or we're gonna, associating those two things can also help too. So as kind of a reward for being so brave and so strong and different things like that can be really helpful, especially in our younger kids.
Yes, absolutely. Dr. Fatui, anything to add to that? What can folks expect when they go to see, when they're taking their kids to the dentist? Are they going to get x-rays? How can we best prepare folks?
Yeah. When we see them, that's like Brittany said too, seeing them earlier is better so we can start to desensitize them, and start with just toothbrushing, but we don't necessarily have to push kids. So we can do, toothbrush prophy if, they don't like the handpiece that we use. We show them everything. We take our time to make them feel comfortable, but usually we like to start taking x-rays, not when they're super little. So if they start coming when they're super young and the teeth aren't, closed yet, unless there's something big that we need to see on an x-ray, we can just, start with making them feel comfortable by just cleaning the teeth, and fluoride, and then go from there. But I think the earlier the better so that they can start feeling more comfortable with it. And I think it's also nice at Mott, at least too, when children come here to see their primary care physicians, they refer them up here a lot. So families come here for all of their care. And so it's helpful too in, the doctors promoting them coming and us seeing them. So it's a good relationship.
That's so important. Thank you for sharing that. We've added one more person to the conversation. Dr. Polk, can you introduce yourself and kind of share your thoughts on what we've been talking about?
Hi, I'm Dr. Denise Polk, and I am a general dentist here in the Flint area. I'm also an instructor at my community college and provide a lot of dental assistance and dental hygienists to the community. So, yeah, the importance of fluoride is immense. We see so much decay in little people. I don't treat a lot of children anymore as I used to when I first started practice, but the ones that I do see, we still see a lot of dental decay in them, and fluoride has helped tremendously in that. And one thing that I put it in the chat that parents tend to do is they'll give the baby a bag of, Cheerios or some sort of cereal, and they munch on this all day long. And, they don't realize that that's turning into sugar in their mouth. And this is part of the reason why they have so much decay. And they said that, oh, but I don't give them candy, but you give them cereal all day. So that is a contributing factor also.
Yes, absolutely. Thank you for sharing that. And we're so glad that you can join us. Mott is such a
You're
wonderful
welcome.
resource in our community. We would love to I'm going to put a plug in right now. So just hang on, guys, because we'd love to have you all come back and talk about the amazing work, the education that you guys are doing at Mott. So let's connect. But also, what are you seeing in the community for trends and for folks that are coming in for care? What are some common things that you guys are seeing for adults? Yeah.
For adults, just in general, patients are coming in for just standard care, and we do still see quite a bit of dental decay and dental disparity. So, getting those patients treated and taken care of. And a lot of patients don't have insurance, and that poses a problem when they don't and they stay away so long and just let the problems get worse and worse. So, and then they have more treatment than they anticipated.
So better if you can do it early, get it out of the way, start the process, than to put it off because it's not going to make it any easier.
No.
I've been there myself. I know. But wonderful conversation. Thank you all so much. We're going to transition and invite Dr. Learoff to join us. She's going to talk about HPV, and you might be thinking, what's the relationship between HPV and oral health? Stay tuned because she's going to fill us in on that.
Yeah. Okay, got it. All right, do you see my presentation? I just want to make sure. I've run into issues before, so
No issues. It looks perfect.
okay. All right. I will go on. So my name is Caitlin Learoff. I'm an infectious disease physician here at Hurley, but I also work with medical students and residents through the Michigan State University College for Human Medicine. And today I've been asked to talk a little bit about HPV and oral health. I just want to say off the bat, I welcome any questions. So please feel free to put them in the chat. And then I included my email at the end. Always happy to answer any questions related to this or anything infectious disease related. So please feel free to email me. So first off, what is HPV? Undoubtedly, it is an acronym that a lot of you have heard about, but it stands for the human papillomavirus. There are over 200 different types of this virus. Some affect the skin, others specifically the mouth, throat, or genitals. It's associated with over 14 different types of cancer and also genital warts, which is not cancer. The types of HPV that cause cancer are different than the types of HPV that cause genital warts. The vast majority of people are exposed at some point in their life. It's estimated to be between 80 to 90% of all people who are sexually active are exposed at some point. So it's very, very common, even if you have no symptoms of it, even if you've always had negative pap smears. It's the type of a virus that you can get and your body can clear, and you may never even know you've ever had it. So I really think when we talk about HPV, the way we need to talk about it is not something that you could get in a rare circumstance, but something that you will mostly inevitably be exposed to. So HPV is primarily transmitted by skin to skin or skin to mucosa. So by that, I mean skin to, oral mucosa or genital mucosa contact. It can be contracted repeatedly, so you can be exposed to it. At one point, your body may clear it, and you can be exposed to it again and contract it again. It can go away on its own, or it can persist throughout life. It's a very versatile virus in that way. Oral HPV specifically can be contracted through kissing, oral sex, or very rarely, the virus can also be aerosolized. What this means is specific to individuals who are in professions that might be, working with sites related to HPV. So OBGYNs who do pap smears, ear, nose, and throat doctors, or dentists who work a lot with oral mucosa or genital mucosa can definitely be exposed to it in that way. However, in the grand scheme of things, that's a very rare way to contract the virus. Some HPV types, like I mentioned, especially HPV types 16 and 18, are linked to oropharyngeal cancers and also to cancers in other sites. When we talk about the oropharynx, that's a very clinical term, but what that basically means is anything kind of from the neck up. So the soft palate, the tonsils, the tongue, the base of the tongue, salivary glands, all of that is encompassed by the term oropharyngeal. However, specifically when it comes to head and neck cancer related to HPV, we think about throat cancer, tonsillar cancer, or cancer involving the base of the tongue or the pharynx. By the numbers, HPV causes 100% of cervical cancers, 90% of anal cancers, 70% of vaginal and vulvar cancers, 60% of penile cancers, and about 60 to 70% of oral pharyngeal cancers. So it's very, very important to understand the relationship between HPV and cancer because we have a vaccine for it. And it's one of the few types of cancers that we have a vaccine for to stop it from happening in the majority of cases. So it's very important to think about it as something that could be preventable. This slide gets a little bit in the weeds, but I think it's always important to understand how you go from getting an infection to developing cancer. So in certain cases, the HPV virus can incorporate itself into your host or an individual's DNA. And when that happens, there are two specific proteins, E6 and E7, that can decrease the likelihood that cells will stop dividing. And over time, that can go from having normal tissue, normal epithelium, to dysplasia, which just means skin tissue cells that look abnormal, to carcinoma, which is the term for cells that are very abnormal and that can't stop dividing. And so that's how HPV goes from initial infection to the development of cancer. So who is at risk? Basically everybody. As I said, more than 80 to 90 percent of people will get HPV at some point in their life. So it's important to think about your risk as pretty universal. Annually, there are currently about 37,000 cases of HPV-related cancers diagnosed. Specifically, when it comes to head and neck cancer, this is seen more commonly in men than women. It is more commonly seen in people with multiple sexual exposures. Really, that is related to just more risk to contract the virus more than once. Head and neck cancer is also associated with tobacco and alcohol. So in people who have HPV exposure and also tobacco use, that exponentially increases their risk of head and neck cancer. And in general, risk also increases with age. It's important to note that when we talk about head and neck cancer, most people have no symptoms at all until the late stages. So a lot of times by the time you have symptoms, it's already progressed. I apologize, part of my the sentence is cut off here, but some of the symptoms include persistent sore throat, hoarseness, difficulty swallowing, swelling of lymph nodes in the neck. Neck is that word cut off there, as well as unexplained weight loss. And the reason why screening and keeping touch with regular care is so important, again, is because the symptoms of this aren't generally present until later in the disease. So keeping your dental appointments, keeping your doctor's appointments, these things can help to catch the development of cancer earlier. As I mentioned earlier, and probably the most important thing to take away from my portion of this presentation is that you can prevent 60 to 70% of head and neck cancers with the HPV vaccine. This vaccine is technically recommended by the CDC for those between ages 9 to 26, but it's actually approved up to age 45. And truly, even though it may not be largely studied beyond age 45, there's no clear reason why it would be dangerous for people above 45. So if somebody maybe is going back into the dating world after having not been in it for many years, there's no reason that they can't get the HPV vaccine beyond the age of 45. This vaccine specifically helps prevent cancer-causing strains, although it does also have efficacy among many of the strains that cause genital warts. Also, avoiding tobacco and alcohol can help decrease your risk of head and neck cancer, and practicing safe sex and good oral hygiene is another way that you can decrease your risk of developing the HPV infection and then HPV-related cancers. So the most common vaccine that is given is the Gardasil vaccine. This is the Gardasil 9. It protects against 9 different HPV types, including those that are most. Other vaccine types that have been available in the past include the quadrivalent and bivalent vaccines. Although these vaccines definitely protected against 16 and 18, which are the most likely to cause cancer, they didn't have as much coverage for some of the other types that cause warts and other types of cancer. And so the Gardasil 9 is really the best one out there right now. So children ages 11 to 12 are recommended by the CDC to get the HPV vaccine to really start those conversations. However, it can be given as young as 9. And if given up to age 14, only 2 doses are necessary. These 2 doses are to be given generally about at least 6 to 12 months apart. If for any reason a child gets the second dose of the vaccine before 6 months have passed, then they will need a third dose. For anybody over the age of 15, including up to and beyond age 45, they will need 3 doses of the vaccine. Additionally, anybody who has a weakened immune system, whether that is from HIV, being on steroids, being on chemotherapy, any sort of immune deficiency syndromes that someone is born with, they will need 3 doses of the vaccine to increase immunity. And I also want to say the vaccine is very effective. We will talk specifically about its efficacy in stopping certain cancers, but about 98% of people who are given the vaccine do mount an appropriate immune response. So it's a very, very effective vaccine just from an immunologic standpoint. So in general, most people with HPV do not get cancer. Again, 80 to 90% of people are exposed to HPV, and 80 to 90% of people don't get cervical or head and neck cancer. However, the vast majority of head and neck cancers and cervical cancers are associated with HPV. So it's important to remember that it's still important to get the vaccine because you don't know which group you're going to be in. Additionally, regular medical and dental checkups can catch problems earlier. And you can be your own advocate in that way by making sure that you keep following with your dentist and following with your doctors. Vaccination is very, very effective. We're getting more and more data out about this. It's a little bit complicated because, of course, a lot of these cancers present later on in life. And so the HPV vaccine is a relatively newer vaccine, compared to some of the vaccines that we've had forever, like the Tdap or the polio vaccine. But it has been found that among teen girls, infections with HPV types that cause HPV cancers and genital warts have dropped 88%. Among young adult women, infections with HPV types that cause HPV cancers and genital warts have dropped 81%. And among vaccinated women, the percentage of cervical precancers caused by HPV types most often linked to cancer has dropped by 40%. Some of this, I expect these numbers to continue to improve as the number of vaccinated people in the general population increases. The HPV vaccine can prevent more than 90% of HPV-related cancers, and studies have also shown that HPV vaccinations have an efficacy of 88% in protecting against oral HPV infection. So incredibly efficacious vaccine, a real tool that we have to help decrease unnecessary pain and suffering later on in life. So what can you do? You can get vaccinated. You can vaccinate your kids, and you can also talk to your doctor or dentist about any concerns and support community education and prevention efforts. I really encourage you too, if you have any questions about these vaccines, there is data that there is increasing vaccine hesitancy, even for HPV specifically preceding COVID. And when a lot of this conversation began, people were still hesitant about the HPV vaccine specifically. So if you have questions, get answers. It's not a crime to have questions. And, understandably, there's been a lot of faith lost in public institutions. And so it's important, if you have those questions, get your answers from, informed people so that they can help clear up any misconceptions that you have. It would be worse to not ask questions and not get vaccinated than to fully explore, what your concerns are and what options are available to address those concerns. I just want to highlight this here. This was actually a paper published by some very passionate people, including Joanne Herman at the Genesee County Health Department, looking specifically at HPV vaccination coverage in Genesee County. Unfortunately, as a county, we have pretty dismal data when it comes to this. So the national vaccination rate among girls in the United States is around 61%, but in Genesee County, it's only about 37% as of 2018. In the United States, the national vaccination rate for boys is about 56%, but in Genesee County is still only about 36%. These numbers are about 8% lower than the state average and over 20% lower than the national average. So there really is a lot of concern in Genesee County and a lot of people that are not getting this opportunity to be vaccinated. And so we all really need to work to, dispelling misconceptions and promoting vaccination. These charts are taken directly from the article, and they just show the specific trends. And you can see even beyond 2018, when that quote was from, in Genesee County, we're still only at about 37.3% for girls. The state average is 45.7%, and the national average is 61.4%. So we're well below other communities in this country. Among boys, very similarly, the Genesee County is even worse, 35.5% among boys as of 2023, 43.4% in Michigan, and 56% nationally. So there's a lot of work to be done. If you guys have any questions, I would like to direct you to the CDC. They have a lot of good information about the HPV vaccine, a lot of good frequently asked questions pages. The American Cancer Society is where most of my cancer data was taken from for this presentation, and they have also just a lot of good information about HPV and cancer specifically, including head and neck cancer, which I know is the focus of today's talk. If you would like HPV vaccination or have any questions, the Genesee County Health Department has a lot of passionate people that are working on this. And then if you have any other general questions, please feel free to email me. I both my Hurley email and my MSU email here, and I'm happy to answer questions at any time. So with that, I'm going to stop sharing my screen, but I'm happy to answer some questions.
Absolutely. Put your questions in the Q&A. You touched on a couple things that are so critical. One of them being it's okay to have questions. It's okay not to understand. But one of the things that we're able to do through this platform is to provide you with experts and faces that you'll see when you go to Hurley, when you go to Mott Children's Health, when you go to Mott, all of these places that we have folks that are, again, so passionate about sharing information, equipping our community members to make good health decisions. The resources are there for you, and one of them is our webinar. I am going to round us out, but still add those questions to the Q&A. Don't forget, if you are a community health worker, number one, we appreciate you. We're grateful that you're here. You can get those continuing education units for free through MiCHWA, so make sure you do that. And with that, we round out our May Flint Community Webinar. We look forward to seeing you in June.